Preventing pregnancy is a deeply personal decision, and today there are many methods available to suit different needs, lifestyles, and health profiles. Abstinence. Abstinence means choosing not to have any kind of sex that could lead to pregnancy. This method is 100% effective at preventing pregnancy because sperm never has a chance to meet an egg. People of any age or sexual history can decide to practice abstinence at any time. It also protects against sexually transmitted infections, STIs, if all types of intimate sexual contact are avoided. Some people choose abstinence for personal, religious, or health reasons, and it does not require any medicine, devices, or ongoing costs. Abstinence can be practiced temporarily or permanently, and people can choose to be abstinent at different times in their lives. It gives people complete control over their reproductive choices without any side effects or health risks. Outer course is when people do sexual activities that do not include putting penis in a vagina. Examples are kissing, touching, mutual masturbation, or rubbing, but not vaginal sex. Outer course is 100% effective at preventing pregnancy as long as semen does not get on or near the vulva or inside the vagina. However, some types of outer course, like oral or anal sex, can still spread STIs, so using barriers like condoms or dental dams is recommended for protection. Outer course allows couples to be intimate and express their sexuality while avoiding pregnancy. It requires good communication between partners and careful attention to avoid any contact between semen and the vaginal area. Male condom. A male condom is a thin cover, usually made of latex, polyurethane, or natural materials that fits over the penis during sex. It catches semen, so sperm cannot get into the vagina. Male condoms are easy to buy at most stores, pharmacies, and health centers, and do not need a prescription. They are the only method that also protects well against most STIs, including HIV. They are most effective when used every time, the right way, and can be used with other methods for extra protection. Condoms come in different sizes, shapes, textures, and even flavors. Some are lubricated to make sex more comfortable, and some contain spermicide for extra protection. Condoms should be checked for tears before use and stored in a cool, dry place away from sharp objects. Female condom. A female condom is a soft pouch made of polyurethane or nitrile that is put inside the vagina before sex. It has a flexible ring at each end. One stays outside the vagina and the other goes inside. It lines the vaginal walls and catches semen, stopping sperm from reaching the egg. Female condoms also help protect STIs by keeping sexual fluids from mixing. They can be inserted up to 8 hours before sex, giving more control to the person wearing it. They are a good option for people who cannot use male condoms due to latex allergies or other reasons. Only one condom, male or female, should be used at a time to avoid tearing. Female condoms can be more expensive than male condoms, but provide similar protection. Diaphragm. A diaphragm is a soft, dome-shaped cup made of silicone that you put inside the vagina before sex. It covers the cervix and blocks sperm from entering the uterus. Diaphragms must be used with spermicide, a chemical that kills sperm, to work best. They can be reused for up to 2 years if cared for properly and must stay in place for at least 6 hours after sex, but no more than 24 hours total. A doctor or nurse must fit the diaphragm to make sure it is the right size for your body. The fit may need to be checked again if you gain or lose more than 10 pounds, have a baby, or have pelvic surgery. Diaphragms need to be washed with mild soap and water after each use and stored in a clean, dry place. Cervical cap. A cervical cap is a small cup-shaped device made of silicone that fits tightly over the cervix like a thimble. It blocks sperm from entering the uterus and must be used with spermicide to be effective. The cap can be put in up to 40 hours before sex and left in for up to 48 hours total. It is less effective for women who have given birth vaginally because the cervix shape changes after childbirth. A doctor must fit the cap to make sure it is the right size and teach you how to insert and remove it correctly. Like the diaphragm, the cervical cap can be reused for up to 2 years with proper care. It should be checked regularly for cracks, holes, or other damage that could make it less effective. Contraceptive sponge. The contraceptive sponge is a small round piece of soft foam that contains spermicide, non-oxynol 9. It is inserted deep into the vagina before sex, where it covers the cervix and kills sperm while also absorbing semen. The sponge can be used for multiple acts of sex within 24 hours without adding more spermicide, but it cannot be reused after removal. It must stay in place for at least 6 hours after the last act of sex. The sponge does not protect against STIs and may cause irritation in some people, especially with frequent use. It is less effective for women who have given birth vaginally. The sponge is available over the counter and comes with instructions for proper insertion and removal. Spermicide. Spermicide is a chemical that kills sperm or stops them from moving. The most common type contains non-oxynol 9. It comes in gels, foams, creams, films, and suppositories that dissolve in the vagina. Spermicide is put into the vagina before sex, as close to the cervix as possible. It is not very effective when used alone, about 72% effective, but it works better when used with barrier methods like condoms, diaphragms, or cervical caps. Spermicide must be used every time you have sex and should be inserted no more than 1 hour before sex. It can sometimes irritate or increase the risk of UTIs in some people. Frequent use may increase the risk of HIV transmission, so it should not be used multiple times per day. Birth control pills, combined and mini pill. Birth control pills are medicines you take every day at the same time. The combined pill has 2 hormones, estrogen and progestin, while the mini pill or progestin-only pill has only progestin. Both types work by stopping the ovaries from releasing eggs and making it harder for sperm to reach an egg by thickening cervical mucus. The combined pill also thins the lining of the uterus. Pills are very effective if taken at the same time every day, but do not protect against STIs. Missing pills or taking them late can make them less effective. Some pills come in 21-day packs with a week off, or 28-day packs with reminder pills. Pills may also help with acne, heavy periods, and menstrual cramps. They require prescription and regular checkups with a healthcare provider. The birth control patch. The birth control patch is a thin, square, beige-colored patch that you stick on your skin. It releases hormones, estrogen and progestin, through your skin into your bloodstream to stop your ovaries from releasing eggs and to thicken cervical mucus. You wear a new patch each week for 3 weeks on areas like your upper arm, back, stomach, or buttocks. Then take 1 week off. The patch stays on during swimming, bathing, and exercising. It is easy to use, and you don't have to remember to take a daily pill, but it does not protect against STIs. Some people may have skin irritation where the patch is placed. The patch may be less effective for people who weigh more than 198 pounds. The vaginal ring is a small, flexible, clear ring made of plastic that you put inside your vagina. It releases hormones, estrogen and progestin, that prevent the release of eggs and thicken cervical mucus. The ring is worn for 3 weeks, then removed for 1 week to allow for a menstrual period. It is easy to insert and remove, and most people cannot feel it once it's in place. The ring stays in during normal activities, including sex, but can be removed for up to 3 hours if needed. It is effective and convenient because you only have to think about it twice a month, but it does not protect against STIs. The ring requires a prescription and regular checkups with a healthcare provider. Contraceptive injection. The contraceptive shot is a hormone injection containing progestin that you get from a doctor or nurse every 8 to 13 weeks, depending on the brand. It stops the ovaries from releasing eggs and thickens cervical mucus to make it harder for sperm to reach an egg. The shot is very effective if you get it on time and does not require daily attention like pills. It is private and convenient for people who don't want to use daily or weekly methods. The shot does not protect against STIs and may cause changes in periods. Some people stop having periods while others have irregular bleeding. It may take up to a year for fertility to return to normal after stopping the shots. Implant. The implant is a tiny, flexible rod about the size of a matchstick that a doctor or nurse puts under the skin of your upper arm using a special tool. It releases a hormone called progestin, which stops the ovaries from releasing eggs and thickens cervical mucus. The implant works for up to 5 years and is over 99% effective, one of the most effective methods available. It can be removed at any time if you want to get pregnant, and fertility usually returns quickly. The insertion and removal procedures are quick and done with local anesthesia. The implant does not protect against STIs and may cause changes in menstrual bleeding patterns. Copper intrauterine device, IUD. The copper IUD is a small, T-shaped device made of plastic wrapped with copper wire that a doctor puts into your uterus through the cervix. The copper creates a toxic environment for sperm, making it very difficult for them to reach or fertilize an egg. The copper IUD does not use hormones and can work for up to 10 to 12 years, making it a long-term, reversible option. It is over 99% effective and can also be used as emergency contraception if inserted within 5 days after unprotected sex. Some people may experience heavier or more painful periods, especially in the first few months. The IUD does not protect against STIs. It can be removed at any time by a healthcare provider if you want to get pregnant. Hormonal intrauterine device, IUD. The hormonal IUD is also a small T-shaped device that goes in the uterus, but it releases a hormone called progestin instead of copper. The hormone thickens cervical mucus, changes the lining of the uterus to make implantation less likely, and sometimes stops the ovaries from releasing eggs. It can work for 3 to 7 years, depending on the brand, and is over 99% effective. The hormonal IUD often makes periods lighter, shorter, or may stop them completely, which many people find beneficial. Uh, like the copper IUD, it can be removed at any time by a healthcare provider. It does not protect against STIs and requires a prescription and insertion by a trained healthcare provider. Tubal ligation, also called getting your tubes tied, is a surgical procedure for women who are sure they never want to become pregnant. During the surgery, the doctor cuts, blocks, or seals the fallopian tubes so eggs cannot travel from the ovaries to meet sperm. This is considered a permanent method, though it may sometimes be reversed with another surgery, but reversal is not always successful. The procedure can be done through small incisions in the abdomen or sometimes right after childbirth. It is over 99% effective and does not affect hormone levels or menstrual cycles. Recovery usually takes a few days to 1 week. Tubal ligation does not protect against STIs. A vasectomy is a simple outpatient surgical procedure for men who are sure they do not want to father children. During the procedure, the doctor cuts or blocks the vas deferens, tubes that carry sperm from the testicles. This prevents sperm from mixing with semen, so ejaculation cannot cause pregnancy. The procedure takes about 20 to 30 minutes and is done with local anesthesia. Vasectomy is considered permanent, though it can sometimes be reversed with a more complex surgery. It does not affect hormone production, sexual pleasure, or the ability to have an orgasm. It takes about 2 to 3 months for all remaining sperm to clear from the system, so another form of birth control is needed during this time. Vasectomy does not protect against STIs. Emergency contraceptive pills. Emergency contraceptive pills, sometimes called morning after pills or Plan B, are pills you can take after unprotected sex to help prevent pregnancy. They work best if taken as soon as possible after sex, but can be effective up to 3 to 5 days later, depending on the type. The most common types contain either levonorgestrel or ulipristal acetate. These pills mainly work by stopping or delaying the release of an egg from the ovary, and they may also make it harder for a fertilized egg to attach to the uterus. They are not abortion pills and will not end an existing pregnancy. Emergency pills are for occasional use only and should not replace regular birth control. They do not protect against STIs and may cause temporary side effects like nausea or changes in your next period. Copper IUD as emergency contraception. A copper IUD can also be used as emergency contraception if it is inserted by a doctor within 5 days after unprotected sex. It is actually the most effective form of emergency contraception, preventing over 99% of pregnancies when used this way. The advantage is that once inserted, it can continue to provide long-term pregnancy prevention for up to 10 years if desired. The insertion procedure is the same as for regular IUD insertion and must be done by a trained healthcare provider. Like regular IUD insertion, there may be some cramping and discomfort during and after the procedure. The copper IUD does not protect against STIs. Fertility awareness, natural family planning. Fertility awareness, also called natural family planning or the rhythm method, means learning when you are most likely to get pregnant during your menstrual cycle and avoiding unprotected sex on those days. This involves carefully tracking your menstrual periods, taking your body temperature every morning, and checking changes in your cervical mucus. During fertile days, couples either avoid sex completely or use barrier methods like condoms. This method requires dedication, careful record keeping, and regular menstrual cycles to be most effective. It works best for people with predictable cycles and strong motivation to track daily. It is less effective than most other methods and does not protect against STIs. Some people like this method because it is natural and helps them learn about their bodies. Withdrawal, pull-out method. Withdrawal, also called the pull-out method, is when the penis is pulled completely out of the vagina before ejaculation, when semen comes out. This is supposed to keep sperm from entering the vagina and reaching an egg. However, this method is not very reliable because it requires perfect timing and self-control every single time. It can be difficult to predict exactly when ejaculation will happen, and some sperm may be present in pre-ejaculate, the fluid that comes out before ejaculation. Withdrawal requires a lot of experience and control from the male partner and does not protect against STIs. It is better than using no method at all, but much less effective than most other forms of birth control. Lactational amenorrhea method, LMM, is a natural method that can work for new mothers who meet very specific conditions. They must be exclusively breastfeeding, no formula, water, or solid foods. Their baby must be less than 6 months old, and their menstrual periods must not have returned. When all these conditions are met, breastfeeding changes hormones in the body and can stop the ovaries from releasing eggs, helping prevent pregnancy. The method is about 98% effective when used correctly, but effectiveness drops quickly if any of the conditions are not met. For example, giving the baby even small amounts of formula or water can reduce effectiveness. LAM does not protect against STIs and is only temporary. Another method must be chosen once any of the conditions change. Breastfeeding as birth control. Exclusive breastfeeding can help prevent pregnancy for the first 6 months after giving birth, but only under very specific conditions. The mother must feed the baby only breast milk. No formula, water, juice, or solid foods. Breastfeed frequently throughout the day and night, at least every 4 hours during the day and every 6 hours at night. And her menstrual periods must not have returned. This works because frequent breastfeeding keeps hormone levels high, which can prevent ovulation. However, this method becomes less reliable as the baby gets older, starts sleeping longer, or begins eating other foods. It is about 98% effective when all conditions are met perfectly, but many mothers find it difficult to meet all requirements consistently. It does not protect against STIs. Natural methods, general. Natural methods include abstinence, fertility awareness, withdrawal, and breastfeeding-based methods. These approaches do not use any devices, medicines, hormones, or surgical procedures. Instead, they rely on understanding the body's natural fertility patterns, timing, and behavior changes. While some people prefer natural methods for personal, religious, or health reasons, they generally require more knowledge, discipline, and motivation than other methods. They can work well when used correctly and consistently, but are usually less effective than medical methods and do not protect against STIs. People who choose natural methods often benefit from education and support from healthcare providers or certified instructors who can teach proper techniques.